Go.
Okay, so I'm going to be doing some active range of motion of the shoulder. So I will get you to stand up, please. Okay, and I'll have you abduct your arms, so thumb up, that's the side, as far as you can. Any pain or discomfort? No? Okay, and then I'll have you flex, so all the way up. Any pain or discomfort? No? Okay, and then all the way back, motion. Anything back? No? Okay, so we'll do horizontal abductions, so start here, all the way up. Okay, and then all the way in. Abduction, anything like that? No? Okay, and then internal external rotation, so I'll get you to bring your hands up to your head. Anything like discomfort? No? And your arm. Anything back? Okay, and then hanging back. Anything? No? Okay, and then the other arm. Pain discomfort? No? No? Okay. So your range of motion is definitely fine. If you did have any pain, recreational symptoms, or decrease in range of motion, then I would go on to passive range of motion of the shoulder. I'm going to do passive range of motion of the elbow, so I'll have you lay on your back. Please. Okay, and then we'll do flexion of the elbow, so I'm stabilizing at the wrist and just proximal to the elbow. Anything discomfort with that? No? Okay. Any extension? Down. Anything discomfort? No? No? Okay. And pronation, supination. Anything discomfort? No? Anything back? No? Okay. You're fine. Alright, so if you did have any pain or discomfort or recreational symptoms on passive range of motion, then it would be an inert structure that would be affected. So I'll go on with active resistive range of motion, which will test for contractile tissues. So I'll have you sit, please. And I will do active resistive in the knee, so flexion extension. So I'll first get you to do it against gravity, so I'll get you to bring your toes to the ceiling. Anything in discomfort? No? And then I'll get you to bring it back. And back. No? Okay. So I'll get you. Okay, so don't. So with active resistive, you want to build the contraction for 5 seconds and hold for 5 seconds. She can move her leg freely against gravity, so she's about at least a 3 on the active resistive gradient. I would think she's about a 5. She's really strong. Push her down. Just my leg. So bring it out play and don't move. Bring it down and extension. Okay, and bring it away. Okay, so I'm going to be doing a neurological scan of C7 and L4. So I'll start with the dermatomes for C7, and if I can get you to hold that like this for me. So one of the dermatome areas for C7 is the index and middle fingers on the palm side of the hand. So I'll just get you to see the difference between the two. Oh, is it okay? Okay, so she's fine for her dermatomes. For myotomes for C7 will be elbow extension. So I will get you backing halfway. And for this. Okay. So if I had any suspicion that she had some kind of contractile issue, then I would do it 5 times and hold for 5 seconds each time. So I'm going to check your reflexes for C7. So that's the tricep. So I'll bring your arm abduction and internal rotation, and I'll get you to hold it right there. Landmark, tricep extending. So she has a fairly normal reflex for triceps. Okay, and we'll do L4. So dermatomes for L4 will go from the lateral thigh across the anterior thigh and down the medial leg to the medial mandibular. So maybe see if you feel a difference between these. Anything back? No? Okay. L4 are fine as well. Myotonics for L4 is ankle dorsiflexion. So I'll get you to bring your toes up to here if you can for me. Okay, so your arm bends up, and halfway, and this. Okay, so our myotones for L4 are fine as well. And the reflex for L4 is the quads reflex, so it's just under the tongue. Okay, and she has a rather normal reflex for that as well. Okay, so I'm going to be doing the anterior dura test on her knee. So it tests for the stability of the ACL ligament. So I'll get you to flex your knee, and I'm going to hold just on the posterior aspect of her knee, pulling the tibia and fibula anteriorly. Okay, any pain or discomfort? Nope. So pain may or may not be present with this test, and if there is an increase in laxity of the joint or a rupture of the tendon, then you would feel an excessive movement. The next test will be Bragard sign, so again I'll get you to flex your knee, and this tests for meniscal tearing in the knee. So I'm going to extend your knee and externally rotate the tibia at the same time, and if it was positive she would feel pain down the lateral aspect of her knee, or of her leg as well. The next test will be the craniocervical flexion test, so it tests the deep neck flexors. So I'll have you bring your chin to your chest like this. Okay, and then bring back 50% and hold. Okay, and you can bring it back down. So this test would be positive if she was unable to hold the position against her enemy. Okay, so now I'm going to be doing Noble's test, which tests for IT band friction syndrome. So I'm going to get you to flex your knee, and I'm going to stabilize over top of the knee, compressing the IT band, and I'll have you extend. Pain?
Yeah.
So she has pain on this test, which means she is positive for IT band friction syndrome. So the pain will be on the lateral epicondyle area of the knee. So I'm going to write that down. My next test will be Thomas test, which checks for hypertonicity in the hip flexors as well as rectus femoris. So I will have you, we'll say this will be your affected leg, so I'll have you bring this chin up, or this knee up to your chest. And hold it, please, yeah. And then I'll get you to bring this one up as well and hold with both hands. And then I'll get you to bring this one up and back down. Just slowly extend it. Okay. So positive for this test would be if the posterior aspect of her knee did not reach the table. It would mean that there was hypertonicity in her hip flexors. She has reached the table, so the test is negative for her. My next test will be Phelan's test, which tests for carpal tunnel syndrome. So I'll have you sit up. Perfect. So I'll get you put your hands together like this, 90-degree angle, and compress them together. Any pain or discomfort? No? Okay. So positive for this test would be pain, numbness, or tingling in any of the forefingers other than